Tonight, Deb Gosgrove and Kelly Himmelsoff, myself, are presenting bone-anchored hearing aid implants, or BAHA. So what are bone-anchored hearing aid implants? A bone-anchored device is a surgically implantable system for treatment of hearing loss that works through direct bone conduction. And there's some pictures of what that looks like. Bone-anchored devices are used to help people with chronic ear infections, congenital external auditory canal atresia, and single-sided deafness who cannot benefit from conventional hearing aids. The system is surgically implanted and allows sound to be conducted through the bone rather than via the middle ear, a process known as direct bone conduction. So how does a bone-anchored hearing aid device work? The bone-anchored device consists of 3 parts: as a titanium implant, an external abutment, and a sound processor. The system works by enhancing the natural bone transmission as a pathway for sound to travel to the inner ear, and it bypasses the external auditory canal and the middle ear. Sorry. How does the bone-anchored hearing aid device work? Continued, the titanium implant is placed during a short surgical procedure, and over time it naturally integrates with the skull bone. For hearing, the sound processor transmits sound vibrations through the external abutment to the titanium implant. The vibrating implant sets up vibrations within the skull and the inner ear that finally stimulate the nerve fibers of the inner ear, allowing hearing. So who's a candidate for the bone-anchored hearing device, or hearing aid device? The bone-anchored devices are used to rehabilitate people with conductive and mixed loss hearing impairment. This includes people with chronic infection of the ear canal, people with absence of or very narrow ear canal as a result of a congenital ear malformation, infection or surgery, and people with single-sided hearing loss as a result of surgery for vestibular, and I'm not going to be able to say this, schwannoma, a tumor of the balance and hearing nerves. Bone-anchored devices for unilateral deafness. Until recently, the best available approach for providing help in this situation has been through the contralateral routing of off-side signal hearing aid. This technique utilized hearing aid microphones worn in both ears and routed the sound from the deaf ear to the hearing ear. And unfortunately, most patients were unsatisfied with this system. And Deb, I believe you take over now.
Okay. Bone-anchored devices for unilateral deafness. The bone-anchored device, now an FDA-cleared solution for unilateral deafness, provides a completely unique benefit. The bone-anchored device is placed on the side of the deaf ear and transfers sound through bone conduction and stimulates the cochlea of the normal hearing ear. This effectively transmits sounds from the bad side to the normal ear and ultimately results in a sensation of hearing from a deaf ear. Stereo hearing results in improved understanding of speech, especially in background noise, and aids in the localization of sound. Bone-anchored devices for unilateral deafness. Stereo hearing results in improved understanding of speech, especially in background noise, and aids in the localization of sound. The bone-anchored device offers significant advantages to the traditional close hearing aid. The device is placed behind the ear, leaving the canal open. It is worn under the hair and is not perceptible to others. Because it is held in place by a clip and directly integrated with the skull bone, there is no need for a headband and pressure against the skin of the head. Bone-anchored devices for unilateral deafness. I'm sorry, I keep repeating that. In recent clinical trials, patients prefer the sound of speech clarity achieved with the bone-anchored device versus the crow's and versus the unaided condition. This includes people with chronic infection of the ear canal.
Hello, sorry, this is Anita joining you.
Okay. People with absence of or a very narrow ear canal as a result of a congenital ear malformation, infection or surgery in people with a single-sided hearing loss as a result of surgery for vestibular schwannomas, a tumor of the balance and hearing nerves. In the cochlear Baha Connect system, the sound processor snaps onto the abutment. In the cochlear Baha Track system, the sound processor is attached to a sound processor magnet. And this is a highly effective bone conduction hearing system designed to leave the skin intact. It uses a magnetic connection to attract the sound processor to the implant, sending sound to the inner ear without anything breaking the skin. A small titanium implant sits in the bone behind the ear. Attached to the implant is an implant magnet that is hidden beneath the skin. The sound processor fits onto the sound processor magnet that attracts to the internal magnet to hold it in place. Sound travels as vibrations from the processor via the magnets to the implant, which then directs the vibrations to the bone to stimulate the inner ear. The sound processor, magnetic connection, and implant. Here's a picture of my son. He has the Baha soft band. He does not have the implant, version, because his skull is not mature enough yet. So as you can see, it sits on one side of his ear, and we move it periodically throughout the day to rotate between the ears. It's a flexible headband to hold the sound processor in place while it transmits vibrations to the bone through the skin, and it's designed to facilitate early amplification for children before surgery is indicated under the age of 5. Of course, he's 10, and he still doesn't qualify. It helps individuals for whom surgery is contradicted and is also used in candidate counseling. The headband is like a soft rubbery material with a plastic snap connector, and it holds the processor firmly but gently in place and adjusts the fastening for easy pressure adjustment, easy to shift position, increasing comfort and usefulness when he's sitting, as you can see, and a built-in safety release. I was going to, oh, go ahead, I'm sorry.
No, go ahead.
I was going to add that the Baha, as you may have been aware of from the training from the cochlear representative, they have a new Bluetooth Wi-Fi ability now. So sound isn't lost in the air, it goes straight directly to the Baha.
So any questions? All right. So Deb, do you want to do the post test, please?
Sure. Okay, number 1, what does Baha stand for? A, bilateral anchored hearing aid. B, bone anchored hearing apparatus. C, bone anchored hearing aid. Or D, bone anchored hot apples. And number 2, the only type of Baha is bone anchored.
Hold on 1 second.
Oh,
Hold
okay.
on. Hold on. Sorry. Okay. Finish up 2 then, please.
Oh, okay. The only type of Baha is bone anchored. True or false?
Okay, question 3.
Who are candidates for a BAHA device? A, individuals with conductive hearing loss. B, individuals with mixed loss hearing impairment. C, individuals with single-sided deafness. Or D, all of the above.
Okay, and question 4.
The BAHA Connect system is designed to facilitate early amplification for children under the age of 5. True or false?
Okay, I'm going to go ahead and pause the recording.
Hi, this is Melissa Joyce presenting along with Anita Mazik for Illinois Guide by Our Side, presenting on American Sign Language, the history and benefits to communication for children with a hearing loss and other needs. There are many different communication choices available to families that experience hearing loss, from sign language to cued speech to spoken English, and multiple combinations in between. Communication choices are very personal and can only be determined by an individual or family, and these choices can often be a changing process as children or adults move through different stages of life or experience different situations. Communication choices cannot be determined simply by looking at an audiogram, as this is not a complete picture of a person's hearing loss and cannot be the only piece of information taken into consideration when communication options are on the table. A little bit of the history of sign language. It can be traced back to the 5th century BC. It wasn't until the 19th century when it became a language that was used beyond manual alphabets or finger spelling. And American Sign Language itself originated in the early 19th century in the American School for the Deaf in Hartford, Connecticut, and was transformed from the old French Sign Language into American Sign Language that American students could understand. American Sign Language is a natural language that has its own grammar and dialects based on geographical areas. Many geographical areas show variations within this natural language, and across the United States, you can get a sense of an accent even here within the same country. There's a complex correlation between sign language and spoken language. In the US, Canada, the UK, Australia, and New Zealand, all of these countries speak English, but ASL is used primarily in the US and most of Canada, which is derived from the French Sign Language, whereas the other countries have dialects from the British, Australian, and New Zealand Sign Language. There are many different forms of sign language beyond just American Sign Language. The first one is American Sign Language, which is used by many deaf individuals in the United States. It's a very visual language and requires no speech reading or listening skills to learn it fluently. It's a very visual and graphic language which promotes easy understanding of concepts. It was developed over time. It is a language that is not usually spoken or written but can be translated, and it does have its own syntax and grammar. Next would be Signed Exact English, or SEE, which is based upon signs from ASL and expanded with words and prefixes, tenses, and endings to give a more complete presentation of English. This provides opportunities for children to develop an expanded vocabulary and is more comfortable for English-speaking parents to use with their children. The combination of these two would be something known as Pidgin Sign Language. It's probably the most widely used communication mode in the United States among deaf and hearing persons who work together. It's often used by many teachers. Its vocabulary is drawn from American Sign Language but follows English word order, but it does not use all of the English words. Any word that does not carry information such as to, the, or am are dropped, as are the endings for English words such as ed. The signer can easily speak while signing since it's possible to keep pace with spoken English, and it's a little bit simpler to learn than ASL or signed exact English. Total communication is often used, which is a blend or a simultaneous use of spoken language and sign language. And then there's also tactile sign language, which is used by people with both sight and hearing impairments. And now I will hand it over to Anita.
Okay, hello. As Melissa explained, there are several different forms of sign language. American Sign Language is the most popular form, and that's because there are many ways to embrace their children with hearing loss. You can have full language and communication access by the way of ASL. It's beneficial for children to have early language acquisition, similar to development and linguistic processing as a spoken language. Early exposure to sign language for children with hearing loss helps to establish communication skills. It also develops language and promotes learning. That includes listening skills and provides opportunities. It provides optional opportunities for academic and social success. So learning American Sign Language is extremely beneficial. The earlier the exposure, the more beneficial. The earlier you start learning a language, a visual language for a person with hearing loss, the better. Next slide. Ready? Can you move to the next slide, please?
Anita, this is Carrie. I turn the control over to you so you can advance your slide. Up at the top.
Sorry, I don't know where.
Up at the top above the slide is the number 10, and there's an arrow, a left and a right arrow. You would just click the right arrow to move forward.
Oh, got it. Okay, thank you. Thank you so much. I thought someone was controlling it for me. I apologize. Now, so we've talked about the benefits of communication. It's very important to embrace, excuse me. I'm sorry, let me just back up here. Some of the benefits of communication for children with hearing loss, even people with speech disorders, deaf blindness, can also benefit from having communication earlier in life. When parents use pictures to communicate, such as having a photo of mom with the word mom and then showing it to a child, or using visual books, the sign for book is also a visual sign, so it promotes understanding based on that concept. Another benefit of communication is that it helps develop intelligence. Social and emotional development is also very important. ASL is a visual language, and it's a very important communication method for children with hearing loss, and as we have mentioned, other special needs. The use of ASL is the best way to communicate also with another adult. And I'll talk more about that in the next slide. Each has its own benefits in using ASL. Language is also beneficial for kids with apraxia, speech. Sign language, when a child has difficulty saying certain words or sounds because of the muscles around their mouth not cooperating properly, can be highly encouraged and beneficial for these children with apraxia, in order to give a child a mode of communication until therapy and cognitive training for the brain to be able to speak orally. Even children who are deaf, hard of hearing, or not deaf, even children who have no hearing loss can benefit from using American Sign Language. It's augmental to them before they're able to use verbal speech. So once they acquire these visual learning skills, they're able to apply them later when they start learning how to speak. It breaks down barriers between the child and adult that they're trying to communicate with. However, sign language can be a way to encourage verbal speech as well. If a child is not able to pronounce their words perfectly, it's less frustrating for them if they have a sign to use as well. So if you expose children to sign language and verbal language, they're able to effectively communicate by whatever mode they can, whether it be verbal or sign. Makes a child feel like they have a backup and they're successfully able to communicate. For some children, they have a hard time moving their hands, arms, or fingers, in which case ASL can be difficult. In this case, you can use communicating through their palm. They may be behind on their language development if they haven't developed this skill. For example, if a child is signing and is not using perfect ASL, a parent could ask, "What are you saying?" by pointing to pictures. And if they point to a picture and then look at what the child is signing, then they're able to reinforce and teach them the appropriate sign. And it helps the child to feel like they actually understand. And they have better comprehension of symbolic communication in this way. ASL is very helpful. Now, on the next slide, we're going to talk about motor speech disorders. Some children without hearing loss are not able to speak well. That's because of a birth defect, an illness, or an accident and brain injury. I would say the best recommendation is to reinforce American Sign Language in several different ways. It breaks down communication barriers. It reduces emotional disturbances and frustration when you cannot communicate verbally. It also prevents from having behavioral issues later because of the increasing frustration. Once a way of communicating is established, it can also help someone feel like they are held in a higher esteem and they have more options for communicating. ASL can lead to speech eventually, and altogether helps to develop a language right from the get-go rather than to have a delay. There are some children who have hearing devices, such as hearing aids, cochlear implants, and several other special assistive devices, such as the BAHA, which we heard about earlier. ASL is still beneficial to these children as a visual language while they are developing their skills in understanding and deciphering these sounds. Some children have a harder time while they're training to hear new sounds, and if you can support their understanding of a concept by way of ASL, they're able to learn things on a more rapid pace. It's important to develop ASL skills early in life because later in life, a child may decide they don't want to use their assistive device, or maybe their nervous system fails and the assistive device does not work any longer. So it's important to be aware of ASL as a backup, just in case later in life these things happen. That's another wonderful benefit. Now, we're going to go on to talk about deaf-blind children. They can't hear, and some children can hear a little bit but are not able to see, and there's a range. In this case, it's tough to decide what sort of language you could use, as ASL is a visual language. If a child can't see, it seems like it would be hard to learn a visual language. There are several other ways you can communicate based on the level of vision and hearing. ASL can be modified to become tactile. In this case, one person's hand rests on the other person's hand to feel the shape and movement and location of the other person's hand in what they're signing. You can use both hands in this way, or you can just use one hand. It's very effective. Another option is adapted sign. And this is useful for people with low vision, but who are not completely blind. So if a person has tunnel vision, say for example, then the interpreter would need to sign in a smaller space. If the person can only see far away, then the interpreter would need to make sure that they back up and sign, or not the interpreter, the person communicated would need to back up and sign in a place that they can actually understand. And this happens with individuals who have Usher syndrome. Tracking is another mode. What it is one person takes their hand and holds near the wrist of another person's hand. And the person who is holding the person's wrist is able to follow their hand and track where their hand is going when they move and sign. And this is helpful for individuals with Usher syndrome who start out having some command of their vision and then later lose more and more and eventually become blind. So if they start with tracking when they can see, then they slowly can move to tactile sign language where they're fully feeling the signs. And there's less delay if they're just starting with tracking right away, so they can start developing this language. Another major benefit for children with hearing loss and Down syndrome using ASL is that some children with Down syndrome and hearing loss are not able to clearly pronunciate their words. And same with other speech disorders. So the use of ASL just increases the level of access that these individuals have. It reduces communication frustrations, misunderstandings, and barriers. So you can use speech with ASL to help a child develop and acquire language through visual and auditory means. ASL is necessary to accelerate language development. Another sign language that is helpful for young children with special needs, or another reason sign language is beneficial, is for kids with special needs. We already talked about Down syndrome. It's also effective with children who have cerebral palsy, autism, aphasia, and other language delays and impediments. Sign language helps them to communicate with the people around them, whether it be caregivers or other people. Children are best able to respond with early intervention by way of several methods at the same time. Sign language could be one of those methods. Alternative communication techniques help to promote a more rapid solution to a situation such as this. Visual, auditory, sign language, interacting helps to acquire language. And I have a fun fact to add that I thought would be cool. Paul D. Hubbard, who is from 1871 to 1946, was a deaf American football player. And he invented the modern huddle today. So you still see it today in the NFL, but it was actually invented at Gallaudet University by a deaf team, a deaf quarterback, and his last name was Huddle. And guess what? Thomas Edison had hearing loss as well from his scarlet fever at a young age. He became a famous inventor. Just a couple fun facts for you. Deaf baby babble is the same as hearing baby babble. When they're using speech for hearing children, deaf babies, while they learn sign, use their hands to babble. And it doesn't mean that there's anything wrong, it's just they're practicing language. They're saying they're uttering their first things. And there is a special sign I could teach you today, the sign for I love you. If you make the letters shape I and then L and then Y, and you hold all of those fingers up all together, the picture on the bottom shows that it's 3 words that are represented by just one sign, and that's I love you, which is pretty cool. It is a language in itself. I have several resources listed on this slide about deaf children, parents and families learning ASL, and the benefits of a sign language. If you're interested to learn more, please feel free to utilize these resources. There's also more information about how deafblind people communicate. Sign language can help with speech. Also, another resource is for children who need help developing language, as well as learning more about kids with Down syndrome, learning sign language and to communicate. Lots of resources available for all of you here. Back to Melissa.
Okay, so we are ready for the post-test. Number 1, communication choices should be made primarily based on a child's audiogram. True or false?
This is Carrie. I'm not seeing anything from Lucy yet. Lucy, did you go ahead? All right, we'll go ahead with question 2.
Number 2, American Sign Language is a natural language with its own grammar and syntax. True or false?
Anita?
All right, question 3.
Number 3, only hearing babies babble. True or false?
Okay, question 4, please.
Number 4, sign language is beneficial for any child that needs help with language acquisition, language development, or communication. True or false?
Okay, and question 5.
Number 5, ASL should never be used with children who have devices such as hearing aids or cochlear implants. True or false?
All right, great, excellent. Thank you for presenting. Any questions about this presentation before we sign off?